Hello, and welcome to this podcast, which is named as Let There Be Vision podcast. This is Dr. Sirish Nelivigi, Ophthalmologist and eye surgeon from Bangalore with you. All of you know that doctors are often focused on not only direct patient care, but also disease prevention, which is very important. Sharing knowledge about diseases is an important element in disease prevention. Doctors can share information or knowledge to their patients in multiple ways, like one-to-one counseling when they are here in the OPD for their checkups, or through the patients through community education sessions as well. In order to fulfill my responsibility of being a doctor, I have created this show known as Let There Be Vision podcast, wherein every week we come out with vision-related health topics and share information about it. And this week, I shall be talking about the basics of cataract, which is a very, very important topic. So let's start. To split this topic up, I am going to cover this in three broad categories. First, I'll tell you what cataract is. In second part of the same lecture, I'll talk to you and tell you what are the symptoms of cataract. And as part of the same podcast, I'll tell you how we diagnose cataract and how we detect it as ophthalmologists. Coming to what is cataract. Cataract, to tell very simply, is just clouding of the lens. Probably most of you would have heard about it. What happens here? If you have seen a photographic camera, there is a lens right in front of the camera which focuses the light, or the image that you need to capture gets passed through that to the back of the camera where the final registration of the image happens. The focusing of the light that comes out from the image happens at the level of the lens. So basically, the lens of the camera is the place where the focusing happens. Similarly, in our eye, we have a lens which is equivalent to a photographic camera, and in eye, this as well is called as the lens of the eye. Whereas in a photographic camera, the lens is made of glass, in our eye, the lens what we have is made up of water and protein. Just like how you have a transparent lens in a photographic camera, the lens in our eye also happens to be completely crisp and transparent. It is this transparent layer or lens which permits the light to come in and gives the proper focus that our eye needs to see. As you can imagine, if the transparency of this lens is lost, the light will not be able to penetrate inside the eye and give a very clear image. This does happen because, unlike a glass which can remain transparent forever, the protein in the eye is an organic substance which can undergo changes over a period of time. As we age, the protein degrades and denaturates. Some changes happen in the protein which makes it lose its transparency. It is this loss of transparency of the clear lens which we call it as cataract. Now, let us talk what are the symptoms of the cataract. Symptoms are basically what the person having cataract feels. When a person has cataract, the most common thing that's going to happen is blurring of vision. Patient or a person may not be able to see the routine things which he takes for granted in a clear way. It may appear as if there is a semi-transparent layer of plastic which is held in front of your eye. You would be able to see the images and the pictures around you or the world around you, but then it will appear as if there is a thin film which has covered on that. This is right in the beginning stages of the cataract. As the cataract goes on advancing, this semi-transparent film-like thing goes on getting more and more dense till it reaches a stage where the person will not be able to see anything at all. Of course, this is the most advanced stage of cataract, which we call it as the mature cataract. Now, as ophthalmologists, how do we make the diagnosis of cataract? To make the diagnosis of cataract, there are two methods. One is using a torchlight, and second is using specialized instruments in our OPD in a hospital, which we call it as slit lamp. With the torchlight, we should be able to make an approximate diagnosis of cataract. When we shine a torchlight from the side of the eye, at the center of the pupil is the central portion which is round. At the center of the pupil, we should be able to see a very slight light gray or a dark gray or a light brown or a dark brown shadow, which is cast because of the torchlight, the light being unable to penetrate the eye. However, making a diagnosis by using a torchlight can be very undependable. We may miss the cataract many a times, and early stages of cataract, we wouldn't be able to detect them properly. When we examine the patient on the slit lamp in our outpatient department, the slit lamp being a magnification device will be able to pick up a cataract in its most early stages. To pick up the cataract more effectively, typically what we do is dilate the pupil of the patient and then examine them on the slit lamp. This way, we will be able to understand how much of the lens is exactly clouded. Different portions of the lens can get clouded, and based on the vision or what we see through the slit lamp, we will be able to identify the exact portion where the cataract has got affected on the lens. If the central portion is affected, this will cause significant blurring for the patient. If the peripheral portions of the lens are affected, the vision blurring caused by the cataract may not be so significant. So based on these criteria, we make the diagnosis and then we tell the patient about the exact extent of the cataract. Friends, this brings us to the end of our first podcast of Let There Be Vision. For free resources and materials for eye-related diseases and conditions and information, head over to nelivigieyehospital.com. I hope you found this podcast particularly useful. We look forward to having you join us again next week for another exciting episode of Let There Be Vision podcast. Thank you so much for listening, and it's me, Dr. Sirish Nelivigi, signing off.